Now, for anyone who's been through it as patient or parent, there are few situations more stressful than when a child is diagnosed with cancer. But what if your child is diagnosed in a war zone? For many children in Ukraine, that means battling brutal circumstances to have a chance at life.
In the middle of his treatment for cancer, little Dmitrik and his family have been forced by Russian bombs to leave their doctors and their country.
There was an opportunity to start treatment abroad, but we decided on Ahmadid because we think this institution provides treatment at the European level. I have 2 older sons. My plan was to get through this, everything would be fine, they would come to visit, and then we'd leave the hospital and be together again. It would have been easier for both my child and for me. But unfortunately, after the terror attack by the Russians, we're forced to go abroad.
3-year-old Dmitrik was diagnosed with leukemia in June and had already begun treatment when a Russian missile struck the hospital, killing several people. Reconstruction work has already begun and doctors continue to treat patients here.
The blast wave damaged almost half of the wing of the department, which was intended to perform intensive, high-dose chemotherapy regimens. We're doing our best to provide children with conditions in which treatment can continue. Parents who want to be relocated can do so, and those who want to can stay for treatment.
So far, 8 patients and their families have chosen to leave for another country. Their trip was arranged with help from the Ukrainian government as well as the World Health Organization and the European Commission. The buses are specially equipped to transport cancer patients whose immune systems are compromised by their treatment.
So we have so-called IPC measures. It's infection prevention control measures, which is wearing gloves, wearing masks, maybe wearing gowns, and isolate the patients from each other. So they should not touch each other, etc. We have teams which are working specifically on one patient.
The bus is headed to an airport in Poland, where the families will catch flights to their final destinations. Dmitrik is going to a hospital in Munich. It's a long journey, but he's excited to fly on a plane for the first time. His father asks him to wave from the sky.
Unfortunately, he doesn't know how long he won't see his dad and his brothers. But we're going to call. We're going to call our boys on Viber, right?
There's hope for Dmitrik and his family. The survival rate of his type of cancer is over 80%.
And for more, we can now speak to Dr. Katerina Bulavinova. She is a health expert with UNICEF Ukraine. Welcome to DW, Dr. Bulavinova. The Akhmadit Children's Hospital in Kyiv was attacked earlier this month. What has that meant for children needing life-saving treatment?
Hello. Of course, this attack was absolutely horrible for children, for their parents, and for the staff. And as rightly mentioned already in your program, it is very important for children not to interrupt their treatment. So the government, the country as a whole, is very grateful for their chance to continue treatment abroad. And I know that a lot of these children were taken to Germany, and not only now, but as well in the beginning of the war, because it's really, really important not to interrupt this treatment, because otherwise it's devastating for the families. And as well, of course, it is a huge stress to go through the event like that. And this is a stress, again, not only for the children, not only for the parents who were there, not only for the doctors, but as well to everybody who witnessed this event. And it was basically the whole country who witnessed it in the news, but as well people who came to help at the spot.
And what about the rest of Ukraine? Do patients needing special treatment often have to be transferred abroad?
In the beginning of the war, indeed, a lot of patients were evacuated abroad, and including actually a lot of patients to Germany, because there is a very good collaboration between our Ministry of Health and German Ministry of Health, and between the First Ladies, Olena Zelenska, and the First Lady of Germany. So a lot of children were transferred to different countries to get the treatment. But however, it's always quite a difficult decision for the family because sometimes people do not want to stay far from other relatives or other children or fathers of these children. So it's always a big choice for the family to choose to go to get treatment abroad.
After almost 2.5 years of war, Doctor, what is the state of the Ukrainian healthcare system? Is it being able to provide treatment, and is it being able to provide for the patients and the war casualties?
I think we are very resistant as a system, and I think we are quite resilient. So the system is functional. And yes, indeed, we are able to provide the help to children and adults. However, there are very big challenges, including the blackouts and including the shortcuts of electricity, which, of course, you can imagine can worsen the situation any moment, and which needs very specific preparation. And there are situations where you cannot be prepared very much with the shortcuts if the shortcut of electricity is too long. And we can imagine that a lot of things are dependent on electricity in the big hospitals. So this is one of the biggest challenges. With regard to the situation which happened to Ohmydyt, of course, the staff of the hospitals is very stressed out and quite often burnt out because including of this kind of fear that any moment there can be a missile attack and nobody knows whether you will remain alive or not. So this is very scary for the staff, of course, and for the patients. And I know that a lot of efforts are taken, and including us, UNICEF, helping the hospitals to get better prepared for such situations, including for the psychological reaction on the spot to reduce the risks of PTSD to everybody who can sort of get into the situation like happened in Ohmydyt. And including the preparedness of the building itself and of the teams on how to react in those situations.
Doctor, one final question. How are medical professionals like yourself dealing with this war and the demands placed on you all?
It is difficult, I think, for everybody, but sort of we get used to it in a way, if you can say so. But we as UNICEF are trying to do a lot to help the helpers. So basically to help the doctors and the nurses who are working now. We have the specific program for them where we provide psychological support and we find psychologists for them and we keep it all very confidential. And as well, we are trying to arrange the spaces for the doctors and nurses to get some rest in the hospitals, because in the Soviet legacy, basically, there was not enough attention to the doctors and nurses, and nobody ever paid attention to the spaces where they can rest at their workplace, where they can relax a bit at their workplace. So we are trying to work from both sides with all the health staff who supports women and children, especially because this is our UNICEF mandate. And I think that this is a very important moment of helping to those who help others.
We'll leave it there for the moment. But thank you so much for joining us today, Dr. Katerina Bulavinova from UNICEF Ukraine. Thanks so much.
Thank you.